Hello and welcome to Unstressed. My name is Dr. Ron Ehrlich. Before I start, I would like to acknowledge the traditional custodians of the land on which I am recording this podcast, the Gadigal people of the Eora Nation, and pay my respects to their elders past, present and emerging. Well, this week we are going to explore a topic that should be on everybody's mind almost all the time, certainly should have been on all of our minds right from the beginning of this pandemic, and that is natural immunity. Yes, it still exists. Yes, it is still part of the human experience. And even though you may be excused for thinking it's not, because our experts who are managing this pandemic say so little about it, and what a wonderful opportunity it is for us all to focus on it, it is still nonetheless reassuringly very real. And all the things that I ever learnt at university about immune function and in biochemistry and in physiology and in immunology and in pathology, it's still a thing. And if I make no excuse for exploring this on a recurring theme, particularly in the last few weeks over the summer series, you will have noticed that we really did bring back episodes that focused very much on that. I also left you at the end of last year with Trust the Science, with a question mark at the end of it. And part of the summer series was The Elephant in the Room, which is specifically about the science and can we trust that science. Anyway, today we are going to be exploring natural immunity. We're going to be discussing what can be done nutritionally, what can be the importance of sleep again. We touch on some really interesting parts about sun and priming our skin for sun and learning when the best time is to get all the benefits of exposing ourselves to the sunshine. So this is going to be a very, I think, a really informative. I learned a lot from my conversation. My guest today is Dr. Olivia Lesslar. Now, Olivia is a functional medical practitioner. She is in private practice and does many of her consultations online. She has many private patients. She has a service, a concierge service, if you like, which just is there for you as a patient to manage your health. And she is a great networker, bringing together many wonderful practitioners that she can draw on. And I think that is really an important part of being a practitioner, and that is to surround yourself with people who you have confidence in their particular expertise, who all have a holistic view on healthcare and understand how their particular specialty fits into your health, as opposed to if your condition doesn't fit into their health, into their interest, then maybe you don't have a problem, or really just go away and do something else. So this is what functional medicine is all about. I'll let Olivia explain that and define it, but really it is understanding that there is a lot going on in the human body and we need to respect every part of it. This was a unique opportunity because many of the podcasts, in fact almost every podcast I have done over the last few years, have been done online, but in this particular case, Olivia Lesslar was visiting Sydney, and so she came to my office and we sat at my desk, and so we were able to chat face to face, which was a wonderful experience, particularly in this time of online Zoom overload, to have a real live guest in my presence and to be able to see them live was really a wonderful experience. So I hope you enjoyed this conversation I had with Dr. Olivia Lesslar. Welcome to the show, Olivia.
Oh, thank you very much, Ron. It's a pleasure to be here.
Olivia, you describe yourself as a functional medical practitioner, and I wondered if we might just start with that. What does that actually mean, and how does that differ from people's experience in the medical setting?
Look, I called myself at one point an integrative medicine doctor, which I guess I still am because I like to employ different modalities. But I say functional now because I definitely have seen this new wave of patient coming through where all their bloods are fine, their scans are fine, and then there's a not too subtle hint that maybe it's just in their head. I saw that a lot, especially with chronic fatigue syndrome patients. And so it's known as a functional disorder, whereby there's something not working quite as well as it should with your day-to-day life, or your illness presentation, symptomatology, whatever it may be. But the scans and blood tests that we use right now are just not picking it up. And then functional medicine, as far as sort of that American terminology goes, is about looking for root cause, right? Trying to figure out why a patient has headaches, as opposed to giving them Band-Aids for those headaches. Now, I have no issues with Band-Aids. They're very helpful. It helps patients with pain. Obviously, we don't want our patients to be in pain. But whatever it is that we do in functional medicine has to have a reason. So yes, we're taking patients out of pain with giving them, paracetamol or aspirin or whatever it may be. But we're also trying to figure out why they got themselves into that position in the first place. And making sure that we are respecting as well what the body is trying to tell us. Pain is a very important mechanism, a very important message. What is it saying to us? And learning then to make sure that we're reading our body, listening to our body, because when patients and doctors, all of us are guilty of this, when we overuse Band-Aids, we stop knowing how to listen to our bodies, and then you basically kind of fall into a really bad cycle, I think. Mm-hmm.
I think it's interesting that you choose chronic pain or pain as an example, because I think a lot of people who are in chronic pain often go through the blood tests, go through the scans, and the doctor looks at them in the face and says, there's nothing wrong with you. And rather than saying, I don't know what's wrong with you, or I need to send you to somebody who does know what's wrong with you. So delving into that root cause is really important. I mean, when we're looking at this pandemic as an example, and I think this has been an example of how we manage disease in general, here's a question that I know is a silly question, but it does need to be asked. Is natural immunity still a thing? I mean, is natural immunity real? I know.
That's a tough one. So, I think I can absolutely understand why people would be a little bit surprised by that question, because that hasn't been brought up, it seems, at all by our health professionals and authority, maybe in Australia, I'm assuming elsewhere as well. And I think part of it, where do we start? Okay. Yes, natural immunity is a thing. Full stop, end of story. All right, everyone, thank you very much.
Thank you.
Yes.
That's very reassuring to hear. But I think it's an important public health announcement.
That's right.
Natural immunity is real.
Yeah, right.
But let's talk about that a bit more.
And the reason why it's sort of, I don't want to say downplayed, but it does feel like that. The reason why it's not discussed as much, I suspect, it's because of how we've been practicing medicine for the last few decades. And that is, if we can't use a pharmacological aid for something, then there isn't as much money or resources put behind those ideas. So every doctor will talk about lifestyle. They'll talk about diet, exercise. But when you actually ask them what that means, they don't actually have much more than you should exercise, or you should eat well, have a balanced diet. That's basically as far as it goes. In the whole pandemic that we've experienced, in the beginning, there was so much signal about vitamin D and zinc, but then it kind of lost a bit of traction to the controversies around ivermectin or hydroxychloroquine. And I know people like drama, and that's another issue that we have in society where, it's the people like the drama of controversy. But for some reason, even though we knew that vitamin D was important, it wasn't mandated, right? It wasn't, and not that it should be, but there wasn't messages about getting out there in the sun and possibly supplementing or encouraging GPs to ask questions about lifestyles such that we could identify those at risk of vitamin D deficiencies so that we could, and then test maybe, and then supplement appropriately. There was none of that. I don't want to be conspiratorial, but it does feel as if a lot of the money got put into that which was medicalized, pharmacologicalized, maybe, and which was a shame.
So listen, let's pretend that the pandemic's just been announced, and we're going to manage it, and we're going to try and firstly why don't we go through three scenarios? One is to say we're going to try and put in a good prevention program, and then there's the person that contracts it, and there's an early treatment, and then where do we go if things start getting really seriously wrong? So let's start with, okay, there's a pandemic out there, folks, and we need to be ready for it. What do we do?
Yeah. Well, it's the sort of basic things that apparently doctors are meant to be talking about, right? Lifestyle modifications, diet, exercise. And we know what you put in your mouth, the food that you eat, the quality that you eat, the nutrient density that you take in makes a difference to how well your immune system works. So the one thing I've noticed is that people are very quick to talk about how bad food, bad habits can then inform disease. You eat, fast food and then you get diabetes, or you get fat, or you smoke and you get lung cancer. Like those sorts of simple correlations, people are more than happy to talk about. But for some reason, even though you can eat your way into a disease, you can't eat your way out of a disease.
That's good. Nicely put.
Right? So eat good food. Make sure that you have all the building blocks that your immune system needs. That's your vitamin D, your zinc, your vitamin A, your E. Look, you can really go on and on and on. But vitamin C is so important for the immune system as a redox molecule. But people roll their eyes about those sorts of things. First of all, it's got the word vitamin in it, which apparently it feels like a dirty word these days. Second, all doctors will say that as long as you have a well-balanced standard diet, you should be fine. But we know that's not true. In fact, government data from the UK and Australia actually shows that there are lots of people running around with suboptimal intakes of zinc, vitamin C, etc. And in fact, I think in Australia, males over the age of 18 have inadequate intake of zinc, and we're not even quite sure why. And that probably does inform a little bit the fact that testosterone levels are sort of falling off a cliff. That's by the by. We know that 70% of people living in old folks' homes have some form of vitamin or nutrient deficiency. But when you talk about supplementation, how many of these people are being supplemented? It's next to zero. I don't know why there's this disconnect. So yes, what you eat, the nutrient density of your food makes a difference. And we may actually have to, before we're talking about optimizing health, we actually have to start talking to people about really basic things. What are the macronutrients? What are the micronutrients? What are the RDIs? What are the faults with RDIs?
Recommended daily intake.
Sorry, yes. AIs, adequate intake. And what are the faults with these things? There was a paper that came out not too long ago, this year, which was talking about the fact that if you go over the data from back in the day, so the early 20th century, when they first put together the vitamin C recommended daily intakes using our modern assays, it's inadequate what is considered RDI for vitamin C. And so there are always going to be holes in those sorts of things. And so as long as you know, stay away from processed foods, eat whole foods. Please, if you can, nutrient-dense foods, i.e. organ meats, preferably. And I know there are a lot of vegans and vegetarians out there. And if you have the genetic ability to transform the pre-vitamins in vegetables into a form that a human can use, fantastic. But if you can't, then that you have to make an informed choice then about your vegetarian or veganism. And then you can either supplement or choose to add in a little bit of animal products. But anyway, yes, food.
Yeah. Awesome. And you've used the word nutrient dense, which is a term that many of our listeners have heard many times. And actually it's interesting that the quality of the food is where that density is. I mean, I think the soils in which they're grown, I know our soils in Australia are really deficient in zinc and selenium and magnesium, all really critically important. it's so interesting because, and deficiencies, common, very common.
Yeah. So I know that a lot of doctors don't feel that way, and so I tend not to use the word deficiency here.
Yes.
I say insufficiency.
Insufficiency. That's a
They're
better one, isn't
less
it?
likely for them to get
Because
their
for
backs up.
many doctors, if you don't have rickets,
Yes.
then you don't have vitamin D problems. If you don't have scurvy, then you don't have vitamin C problems. If you don't have a B deficiency, you don't have pellagra. You know, so
yeah, exactly.
so I like that. What is it? Not insufficiency.
Yes. Insufficient. The people are less likely to get upset about that for some reason.
Yeah.
Funnily enough, I actually saw scurvy when I was in GP land.
Wow.
When was I? I think it was first year of GP training. I had a woman come in, gums were bleeding, wouldn't heal, all the rest of it. Scurvy.
Yeah.
This is a person living in a first world country.
Yeah.
She wasn't. She wasn't living on a desert island. Scurvy. And as it is, everybody in Australia is supplemented in some way, shape, or form, and people don't even realize there's government mandated iodization of salt in Australia because we don't take as a country, as a population, we don't take in enough iodine here. The government knows that and knows how important iodine is, so they iodize salt. Then we have the fancy salts coming through from overseas, your Himalayan pink salt and Celtic salts, and when people moved over to that, we started to see thyroid issues, right?
Because they don't have
they were taking in less iodine.
Right.
What else does the government mandate that we? Oh, well, we've got fluoride in our water. That's a supplementation, right? Mandated by the government. We can get into fluoride.
That's a whole other podcast, folks.
Yes.
But interestingly, I mean, like for example, I had my vitamin D levels. I never had them checked, ridiculous as that may seem, up until about 8 years ago. And I was like at a level of 30 or 40, really low. And I would have been like that for 30 or 40 years because I've done nothing differently.
And so for the folks out there, the lower limit of normal in Australia is 49 nanomoles. So you were below that.
Yes, I know. How and so you check this a lot on patients. How common is vitamin D deficiency in your patients that you see?
It depends on what you use as your reference range.
Okay, yes, I shouldn't use that word deficient, but okay, well, let's look at it. I mean, the range is what is the range? 40 to 90 or something?
49 to 150 in Australia.
Oh, that's the ideal range.
That's the reference range used here.
Right.
I won't use the word ideal, definitely not. But anyway, it's
Okay.
And you're absolutely right about the rickets thing, right? 49 nanomoles was chosen because below that you were at risk of rickets.
Wow.
But there's optimization sciences, optimization health. That's only a very recent thing, the last maybe 20, 30 years.
Mm-hmm.
To be fair, mostly in the US. We're not really even talking that much about optimization health here yet, but we are starting to.
Okay, so how many patients? How common is suboptimal level?
Oh, everybody.
Pandemic.
Everybody.
Yeah, which is extraordinary. Isn't
Yes, I have not seen a optimally replete person for vitamin D here that's not supplementing since I started checking like 3 or 4 years ago.
Yeah.
I was thinking the other accepted mass supplementation by the government is folic acid in our white flour in Australia.
Right. Yes.
Anyway.
Yeah. Yeah. So we've got nutrient dense diet is setting us up better, and possible supplementation to bring us to an optimal level.
Mm-hmm. Yeah. If for whatever reason you can't take in enough of that particular nutrient or vitamin in your food, and there are plenty of those. Plenty of that.
It's a pity we didn't hear that, and I know that at the time that the pandemic started, I was president of the Australasian College of Nutritional and Environmental Medicine. We wrote letters to the TGA, or Professor Ian Brighthope did, who's been a guest on the podcast many times, and he wrote letters which were replied was, there's not enough evidence to support that. Yeah. And the next day, we found out that Resdemivir did have enough evidence to support it, and that evidence was supplied by the pharmaceutical industry. But we digress for a moment. But so we've got nutrient-dense diet as one way of building our immune function. Mm-hmm. Give us one or two others.
So if you have a respiratory illness, if respiratory virus coming your way, how you breathe matters. nasal breathing over mouth breathing is one of the biggest needles that moved in my health when I switched over, because you need the nares with the hairs.
Nares with the hairs.
The nares with the hairs, you know, to filter the air, to warm and humidify the air. The reason why we have all these little turbinates in the nose is to swirl that hair around so that the mucosa is able to see the air for the immune system. Then it hits your adenoids, right? Then it hits your tonsils, it goes into your lungs. That makes a difference. How you breathe makes a difference to your immune system. And you know, your immune system relies on you breathing in an appropriate way so that it can sample the environment and, you know, put into place mechanisms already if there's a virus that it catches early. When we mouth breathe, the tidal volumes are really, really high. You don't do any of the things that we were talking about before. It goes straight into the lungs, and that can be a problem. So how we breathe matters.
There's the nitric oxide as well.
The nitric oxide, yes, from the frontal sinuses.
Yeah, I mean, there was an interesting, after the SARS-1 virus, I saw an article in the Journal of Virology, very light reading it was, which actually talked about, because, you know, it's a focus in our practice a lot on nasal breathing, talked about the fact that the nitric oxide disrupts the reproduction of the virus.
Right.
You know, so it's antiviral, antimicrobial, as well as being a major regulator. So, you know, and we had another guest on the podcast, Rosalba Courtney, who said something to me that whoa, hang on, that was a big one. She said 60% of the body's nitric oxide is produced only when you breathe through your nose.
Right, yeah.
That's huge. So breathing, yes,
breathing
huge.
is huge. I mean, and it's a respiratory virus, so that makes sense. We all know of people who get sick when they're stressed. And, you know, it's a very woo thing for some reason to talk about mindset, meditation, stress, stress relief and dealing with stress. But it's such a big deal for our immune system. You don't want to be in a fight or flight, in a sympathetic dominant state, because your immune system is slightly suppressed. You need that to be optimal if you're dealing with a pandemic, right? And leading off that, sleep. We know that one night of bad sleep, the next day, your NK, your natural killer cells, can actually be working like 30 to 70% less efficiently. Right. It's huge.
That is huge,
right? How well you sleep, and that's, you know, we can go into it, but it's not just the number of hours you're in bed with your eyes closed and your brain's shut off, but it's the architecture of sleep. Whether you're hitting your deep sleep in the first half of the night, whether or not you're getting the REM sleep in the second half of the night, you know, how often are you getting up to pee? You know, how much of this good quality, non-pharmacologically driven sleep are you getting? Because taking a drug to sleep is essentially a chemical baseball bat to the head. Right? You're not actually getting regenerative, rejuvenating sleep. And that makes a difference to your immune system as well.
So I mean, I think that was an interesting one too, by taking drugs or actually alcohol as well.
Yes.
You know, which a lot of people say it makes you easier to go to sleep. It does, but it acts as a sedative, not as a refreshing sleep. You're just as sedated.
And with your Oura ring,
yes,
you would know.
well, actually, this could be a good moment. Should we? No, I want to come back to that in a moment at the end, because this is about wearing a personal device and what the pluses and minuses of that are. So yeah, look, that kind of thing to set yourself up for prevention, and particularly getting your nutrient density right and optimal, is so critical. If you got and imagine, you know, you talk about stress, I think we can all agree that people are walking around really stressed and scared.
And it's much better to live a life less stress, I think.
I heard that, and there's a terrific book about that, but let's not go into that at the moment. Thanks for that plug,
You're
Olivia.
welcome.
I really appreciate that. That was an unpaid commercial. But then say someone got a diagnosis of COVID, and actually it's interesting because it was so rare in Australia that the images coming from overseas were so shocking that people could almost think of it as a death sentence,
Yes.
and were sometimes surprised at the different reactions. But let's say you did get a diagnosis of COVID. You got tested positive, PCR test.
Mm-hmm.
You're feeling a little edgy. What would be some of the things that you would say, okay, well, you've got to get right onto this now?
Mm-hmm. Well, do you know I got COVID about 4 weeks ago?
I didn't know that.
Yeah, so my whole family did. We
Uh-huh.
were in Queensland on holiday,
Mm-hmm.
and I happened to work very closely with an immunologist up there, Professor Pete Smith.
Mm-hmm.
And so he came around and he's like, right, this is what we're going to do. And he provided the conventional aspects to what we were doing, and I did the natural aspects.
Okay, so we're going to get it.
And we all survived.
Okay.
Yes.
Okay, great. So, well,
Okay.
let's go through it.
Right. So he got us on antihistamines. So yeah.
Wow. Okay. Now this is something we were talking about before we started to record, and this is the allergic component of this condition, which I until this morning have not heard really about the use of antihistamines in COVID. Tell us about that.
So the idea is that some of the damage that's caused is because your immune system gets a little bit excited, and part of that story is the inflammatory cytokines or the inflammatory molecules that are found inside a mast cell. Now, when a mast cell degranulates in the face of what it thinks is an enemy, in this case, the COVID, it will degranulate some of its very active chemicals. That includes histamine, IL-6, tumor necrosis factor. And so the histaminergic drive of this disease is what will cause, the excess secretions and the itching and the redness and, the reactions of the blood vessels to this particular disease. Now, endothelial health is super important for COVID, but that's a separate thing. We'll talk about that later. But we, or at least the professor was saying that to make sure that we are helping the immune system not go overboard, we took in a bit of an antihistamine daily.
Okay, and that was just over-the-counter antihistamine?
Actually, we did famotidine, so that was by script. But yes, over-the-counter as well, Zyrtec.
Benadryl?
Benadryl, any of those are fine.
Yeah.
So the idea is that you have a little bit of H1, histamine 1 receptor blocking and H2 receptor blocking too.
Right.
So we were all on 2 different types of antihistamines daily for about a week and a half or so.
Right.
Professor Pete also brought over the nasal sinus rinses for all of us.
Like Fez or...
Yeah, like the Flow or Neti Pot.
Neti Pot.
Yeah, you just go to your kitchen, pull out a teapot, pops your uncle.
Yes. Well, now the Neti Pot's an interesting one. I actually do that daily. And that is, with some warm salt water, and I've added in some betadine, iodine.
Yeah, that's... So Prof also brought in betadine for us, plus he brought in mometasone. So mometasone is it's an anti-inflammatory basically, and we put that into the nasal sinus rinses.
Right.
We did that twice a day.
Right.
We also had a Nasonex or one of those. We basically had nose sprays. Maybe shouldn't be using brands, but anyway.
No, that's fine.
Oh yeah. And also Realtris. So we're using nose sprays to decrease inflammation in that area, because you don't want to have so much inflammation that you're also then mouth breathing, which kind of makes everything worse. So we're doing nasal breathing and making sure that we were decreasing inflammation and secretions there. Pete also brought over, what did he bring? He brought over for me vitamin C.
Yep.
And so everyone was on vitamin C, 500 milligrams 3 times a day / up to 3 grams a day.
Yep. You can use the word vitamins on this program with very
right. So not ascorbic acid, but so vitamin C, and then for the more vulnerable in my group, my uncle who's much older, my cousin who's breastfeeding, I also ran an IV vitamin C.
Right.
So
and what sort of levels would you have gone to for that?
30 grams.
30 grams.
Yeah, I did 30 grams vitamin C with magnesium, zinc. I also had a B complex. So
in the IV.
In the IV. Yeah.
Because it's interesting, isn't it? With vitamin C, it's often said, I mean, we've done programs with various people from the Orthomolecular News Service talking about very high doses of vitamin C. If you took it orally,
you can't reach that sort of
concentration. So taking it orally, there's a kind of a bowel tolerance level.
Yes.
You wouldn't go beyond that where if it gave you diarrhea.
Yeah.
And what would be the levels that people wouldn't get diarrhea at 500 or a gram or 2 or 3? We're talking about 10 grams?
Oh, no, but it'd be less than that. But it's how well you tolerate it, right?
Yes, that's
so
right.
I take 2 grams of vitamin C almost every day. So I can tolerate up to, I think orally I can tolerate up to 10 grams, no problem. But I also take a liposomal vitamin C.
Yeah.
And I think that also does make a difference, the formulation of the vitamin C. But for my relatives, we weren't going past 2-3 grams a day anyway.
Okay. But the IV, the intravenous form, allows you to deliver a much higher dose.
Yes, right.
And how often would you have done that?
I did that 3 times
in a week?
In the 2 weeks.
In the 2 weeks, yeah.
Mm-hmm.
Cool.
I didn't want to push it too much. At the end of the day, you have to cannulate someone. And to be fair, my uncle who's in his 70s, and he has a chronic cough from some other issue, and he actually handled the COVID very well. Very well. Yeah. So, I didn't want to over-medicalize him.
Yep.
We were also taking NAC, NAC.
NAC is what? N-acetylcysteine.
Mm-hmm.
Okay, I've heard a lot. Tell us a little bit about NAC and what sort of dosages were you taking there?
Look, I can't be about 300 milligrams 2 to 3 times a day.
Mm-hmm.
And so NAC is one of the, or cysteine anyway, is one of the ingredients that you need to make glutathione.
Right.
So glutathione, as I'm sure many of your listeners know, it's a part of the end result of the transsulfuration pathway, where you go from homocysteine, down to glutathione, and for that you need B6 and magnesium as well, and homocysteine is from methionine. You go methionine, SAMe, homocysteine, and then you've got to recycle it back by way of.
And glutathione is a really powerful antioxidant.
Right. Yeah, absolutely.
So I think the point that I'm sure many of my listeners are getting is that biochemistry is why these nutrient-dense foods are so important, because every one of these processes is quite complex. Mm-hmm. Much easier to write out a prescription, isn't it? Really?
Yeah, but the thing is, it's a different thing, right? Yeah. Because a prescription is going to artificially blunt a symptom, not fix why you had that problem in the first place. Whereas giving the building blocks to what you need, what your body needs to fight an infection, viral, parasitic, bacterial, whatever it is more important than blunting symptoms.
Mm-hmm.
I totally agree that fixing symptoms, or helping symptoms is important. Of course it is.
Yeah.
But it can't be the only tool in your toolbox.
No.
It's not.
Okay, so NAC,
NAC. NAC. We did something called Mitocu. So Mitocu is a brand. There is a paper that was published about the use of Mitocu with regards to mitochondrial output. So we're trying to support the mitochondria. In that case, it's a patent proprietary blend of not sure what. We were taking magnesium, B vitamins, of course.
Zinc.
Zinc, of course. Yeah. Yes, sorry, zinc. At that stage, we were taking zinc drops.
Okay.
Because I like to be able to titrate that. And also I'm a big fan of taking anything in powdered or liquid form, because then I know that my patients are having water. Which is a problem.
Yep.
And you know what? Every day we would go out onto the jetty. So we're very lucky. The house that we were isolating in had a pool, and it also had a jetty on the canals, and we would be in the sun at least 3 or 4 days, appropriately and safely, of course. 3 or 4 days a day, 3 or 4 hours a day, fishing, swimming, all that kind of stuff.
That's another one of the challenges, isn't it, of this isolation mentality, which I get about why isolation is important at certain things, but it does create this perfect storm, doesn't it?
100%.
It sets us up for, dare I say, not failure, but a bigger fight.
Bigger fight, problems. You know, they're talking about the scourge of mental health problems on children and youth now, following 2 years of lockdown for some places, as being the next epidemic. You know, there are consequences for all our decisions, for all our mandates and laws following this. And many countries did things differently, and I get that. And, you know, I think, or I'd like to think anyway, that everyone was trying their best, governments included, you know. But there's a reason why the Barrington Declaration. Do you know the Barrington Declaration?
I do, but share with us about the Barrington Declaration.
So Barrington Declaration was, you know, a proposal basically, or is it a proposal? A statement, right? A declaration. Funny that.
Declaration.
Essentially started by a couple of epidemiologists and public health experts about being cautious with overusing lockdowns, isolation, you know, non-targeted vaccination programs. Just if you're too broad strokes with what you're doing in what should actually be quite a finessed, nuanced approach, you may suffer consequences to using a hammer to crack a walnut.
Yeah.
I'm a signatory to.
Yes, no, I was too. And I mean, I think it's looking at it more holistically. Dare I use that word? Because when the pandemic came out, we didn't really know what we were dealing with. Yeah, I understood the idea of we don't know, this could be terrible, let's be super cautious. We have a sick population. I mean, you know, I think the statistic is something like 80% of those that have been hospitalised have at least one comorbidity, and there's an average of 2 or 3 or even 4 comorbidities. So, you know, when you think half the population have at least one comorbidity, we've got a pretty sick population.
We do. And the fact that we have been focusing on disease care for so long, you know, this is almost like coming home to roost, right? And so it would have been nice if maybe the powers that be had used this opportunity as a pivot point to start talking a little bit, because we knew from the very beginning, right? People who had those comorbidities were at increased risk of ICU and blah, blah, blah. Vitamin D, right? People who have low vitamin D were more at risk of ICU and having more severe disease. Now, of course, there are always exceptions to the rule. And the media like to take those exceptions and run with it and make, I guess, doctors who were trying to talk more about holistic health or, you know, trying to have a little bit more nuanced approach to this pandemic as being, oh, you don't care about, you know, you don't care about the fact that even young people are getting hospitalized or dying or whatever it is. This is a tragedy. Of course it is, right? But, you know, if you wanted to talk about what's going to move the needle the most, then let's talk about metabolic health. Yeah. Right?
It was an incredible opportunity. It still is, I think.
I think it is.
I think we're going to come to that. I think it kind of highlighted how we approach chronic disease as a management rather than addressing causes, which comes back to our the first question about what defines a functional medical approach, looking at causes rather than managing. But also we're treating disease with medication. So now we're treating this pandemic with a medication, a vaccine. It's something that people are used to.
Yes.
And they accept.
Yes.
And they shouldn't.
Yes.
So how were you? You got all of that. You got Professor Pete Smith, the immunologists, you know, histamine, Nasonex, spray, you know, the Neti Pot, you know.
And we got a Brio as well. So anti-inflammatory inhalant for the lungs. Yes, what we use with asthmatics, for example. So the idea was just to decrease inflammation so that we wouldn't have our immune system going a bit too crazy against this virus and mitigating damage, essentially. So one of the things that we were doing was making sure that we were doing breathing exercises in the sun every day. Right? Absolutely using diaphragmatic breathing, opening up the rib cage, making sure that you're able to actually also have thoracic mobility and taking deep breaths like that. Because It's when you do shallow breathing, when you're sitting down and your guts are pushing up against your diaphragm, you're watching TV, right? Because you're sitting at home, because you're in isolation, because you have this virus, and none of the air is eddying in the small bronchioles. And then you have all this muck sitting there, right? Byproducts of your immune system attacking this virus and the mucus and whatever it is. And it's all sitting there. It's like an inflammatory soup causing damage and scarring. So we were making sure that we were out every day doing breathing exercises.
Yeah. It's interesting, isn't it? Because then you come back to getting out in the sun and we're told, be careful. This sun's very dangerous. So, and yet it could be one of our biggest aids in this whole
allies.
Allies.
So I do skin checks.
Yeah.
Right.
Yes.
I work very closely with a charity called Skin Check Champions, and we do free skin checks for people, usually in collaboration with someone. So we were doing it in Sydney with the Merivale group, for example. We'd set up in a pub, people would get a beer and come and get their skin checked. And recently they did an activation with La Roche-Posay. Now, the whole point of that is about early detection and education. And I'm very close to the guy that started the charity. His name is Scott Maggs. And he and I are both of the same mindset when it comes to this. Yes, early detection is super important. Safe, sensible sun exposure is the message that should be had, as opposed to flee, the sun is out, right? Being safe is about knowing your skin tolerance, which changes, by the way, depending on the nutrients you put inside you, for example. And knowing as well that you need to be out in the sun to make vitamin D, and that can only happen when your shadow is shorter than your body.
Interesting.
The shadow rule.
Rule.
And so
So safe, sensible, and shadow. Sun. But keep going. That's really an important point, that, isn't it?
It is.
Getting out in the sun when the shadow is shorter than you are.
That's right. That's when you can make vitamin D, generally speaking. In other words, the 10 minutes that you get when you're having that early 6 a.m. jog is obviously wonderful, but that's not helping your vitamin D levels.
Right.
And then what happens is another thing that I see all the time is that you have office workers in their cave, their office, and then they, artificial fluorescent light, don't see the sun, and then they do that 12 p.m. burrito run, and they burn or they get red. It's like, I've got Irish blood, right? I can't tolerate the sun in Australia and all these other quite, chicken little stuff. But actually, you haven't primed your skin for midday sun. It's called it's a concept called photoprevention. It's in the literature.
Right.
Because skin has opsins, light receptors, and those light receptors know what frequency of light is coming through the atmosphere. So it knows it's early morning sun as opposed to midday sun. And when it senses early morning sun, 6, 7, 8, it starts to prime your skin. Okay, we're coming up to noon, guys. All right, be ready, so that you can actually tolerate more sun midday. If you see sun early in the day, the more sun you see, the more sun you can see. And of course, the nutrients that you put in your belly make a difference as well to the skin immune system, because every organ has their own special immunity, right? What the building blocks for that, which is why the clues for skin, what's necessary for skin, is going to be found in the products that you slap on your face. So for some reason, people are very happy to buy things to put on the face, but they don't quite yet make that leap about the fact that you also need that in your body.
Right. Vitamin
C, retinoic acid is vitamin A. Right, these are really important. Vitamin C is the cement that actually holds collagen together, the tripeptide. Vitamin C is the cement that holds it together, and is an antioxidant, because your skin is constantly being exposed to oxidative stress, whether it's the UVB in particular, or pollution, and it needs to be able to deal with that oxidative stress with antioxidant capacity, because this is your largest organ, and the functionality of skin is very different to the aesthetics of skin. So in other words, it's about function over form. Your body doesn't care about wrinkles. That's not your your body doesn't care about wrinkles or how you look with regards to, I suppose, wrinkles. What it cares about is its functional capacity to deal with day-to-day living in the sun and the pollution and being in the water. So when people look at photos of wrinkles and they go, oh, I've got to stay out the sun because of that. Well, actually, what's the function of your skin? What's the functionality? How well is it able to protect you? Those are the more important questions.
How do you prime? How do you prime the skin to be able to tolerate that short shadow, healthy vitamin D time?
So photoprevention is super important. Trying to see sun earlier in the day to then lead up to midday sun is one of those things. Making sure that you have all the right nutrients on the inside to handle being outside.
Okay.
And also taking away rubbish, i.e. Seed oils, vegetable oils, linoleic acid. And this is actually in the literature, peer-reviewed literature, that linoleic acid that is found in high quantities in omega-6 rich oils,
which are often those that are promoted by the so-called experts. Stay away from saturated fat, animal fats, coconut oil, all of that. Go for safflower, canola, sunflower. Rice bran oil. These are those seed oils. Go on.
Basically anything that is, oil is oil. Oil oxidizes. So if you're looking at an oil in a clear plastic bottle, you already know that there's either loads of preservatives in there, or they don't care about whether it's oxidized or not. So anyway, because light oxidizes too. So linoleic acid can actually...
consuming those kind of oils sets you up for a bit of a problem in how to deal with
100%.
a lot of other things, let alone this priming of the skin.
So linoleic acid actually predisposes you to inability to tolerate sun. You get more sunburn when you have more linoleic acid in your body. Admittedly as well, you got your omega-6 and your omega-3. So your omega-3s tend to, you've got your linolenic acid and your EPA, DHA, and these, you got your anti-inflammatory molecules like the protectins and the resolvins. But omega-6 by definition goes from omega-6 to linoleic acid to arachidonic acid, and then you got your pro-inflammatory stuff, your thromboxanes and leukotrienes. Now, inflammation is important. It's a signaling molecule. You need to be able to mount an appropriate inflammatory response, but we're talking about appropriate, and that's where things get a little bit muddied.
Yeah. And again, you're talking about, this goes on all the time, inflammation and anti-inflammation. This is why we need antioxidants to deal with that. So there's a balancing act there, but it's when we have too much inflammation, chronic inflammation, which is the common denominator in all diseases.
And, flip side of the coin, where I think that we're trying to be responsible with patients, you can overconsume antioxidants as well. You don't want to be drinking this stuff. You don't want to be, taking IVs like willy-nilly.
Yeah.
It's all about making sure that it's appropriate for you and your lifestyle. Yeah. And that's why things change as well.
Yeah. So with this priming of these other things, if someone was listening to this and going, you know what, I'm changing my whole attitude to sun, but this is a process over days, weeks, months?
Well, I had a patient who was very fair, blue eyes, blonde hair. He was my first concierge patient. This was 2019. You know who you are if you're listening to this. And he came to me because he was only in his early 40s. He was 41, but he had terrible arthritic pain. He couldn't walk. And one of the things that we did, curcumin, we're doing anti-inflammatories, getting his zinc up, all these sorts of blah, blah, blah. And he told me, and I didn't expect this, but he said, interestingly enough, since I've been taking vitamin C and zinc, I can stay in the sun longer than I've ever been able to.
Yeah.
So he used to burn after 3 minutes, and he was now being in the sun for 15 minutes. Mm-hmm. That's when I started going into, and that for him, 4 months?
Took 4 months to slowly build up the internal nutrients and prepare the skin by exposing yourself. You wouldn't kind of go, I'm getting into this now.
Yeah.
I'm getting out in the short shadow sunshine, and I'm going to have, how long? should one be out in that short shadow sun?
Yeah, and it depends, right? The darker your skin, the more the more time you have to spend in the sun to make that vitamin D. So everybody's different, which is why I suppose sometimes testing is very important. In this case, your vitamin D. What is it that you're doing now? Let's just say you're spending an hour in the sun every day at X times during the day. And what is your vitamin D level? That'll tell you if you're spending adequate time or not. Some of us actually have to readjust our lifestyles to be able to deal with that. I know that people go, oh, well, my vitamin D is low, I should just take a vitamin D supplement. Yes, of course, supplementation is important, just like Band-Aids are important, but it's not physiologic. And there's so many other things that we get from sunshine, as opposed to just making vitamin D, that are also important for us. There's a reason why mental health, some of it can hinge on vitamin D, vitamin D as well, but on sun exposure. That's why blue light boxes are utilized in far in areas of closer to the poles when they see no sun, and the blue light actually helps because of the melanopsins in the eye. There's so many reasons to be in the sun and not just for vitamin D.
I mean, melatonin's a big one, isn't it? And,
Exactly.
I mean, I think that I've seen a book which talks about it as the master hormone, 400 pages just on melatonin. I mean, so there's got to be a lot of effects there too.
Actually, yes, because tryptophan is the precursor to serotonin, which is the precursor to melatonin, but tryptophan hydroxylase, that first enzyme that's utilized to break down tryptophan, that's a vitamin D dependent enzyme.
Yep.
So get in the sun.
Yeah.
Appropriately.
Interesting you should mention tryptophan, because I've just recently done another podcast with Todd Penberthy from the Orthomolecular News Service group, and he mentioned something, the throwaway line he said low tryptophan levels were common in all autoimmune conditions.
Really?
And I thought, wow, that's such an interesting statement.
Wow, I didn't know
that. But anyway, it's kind of reminding us again of the complexity of the human body.
Yeah.
And I love this idea that you're talking about what you put into your body being perhaps even more important than what you put on your body in terms of preparing for the sun. That's great. Now listen, I know we looked at each other's Oura rings.
Oh yeah.
and these personal devices are very interesting. Tell me about why you're wearing an Oura ring. And I'm not doing a commercial here, because I've also bought a Whoop as well, WHOOP. I've done that. I've done Aura 2. I've done Aura 3. I'm a study of N=1 here.
Yeah.
But I'm interested in you. What's
I do like toys. I like
toys too.
Yeah, I do like toys. My dad's a gadget person, so I've sort of got a bit of a mindset. And I think it's you can't really change that which you don't know, right? So it'd be good to know how alcohol affects your sleep, for example. Because a lot of people will drink alcohol to sleep, and they say, oh, I need this to help me get to sleep. But what is it actually doing to all the different phases of sleep? Because there are plenty, right? And what is it doing to, how much of deep sleep you're getting? Whether or not you can get into REM sleep, and once you get the data, you can start making adjustments for yourself. It's like with a CGM, a continuous glucose monitor.
Yes,
right?
that's that little injection. No, not it. Well, you do. You zap yourself and it sticks on for 2 weeks and gives you a blood sugar reading.
Yes, continuous blood sugar reading.
Yes, I wore one of those for 2 weeks. It freaked out my wife every time I lifted my arm. She said, put your arm down. But it was so interesting to see how each meal affected my blood sugar.
Yeah.
I mean, but I didn't wear it all the time. I mean, like 2 week period, very educational.
Exactly. It's for education purposes. I mean, obviously there are diabetics who need to use it all the time. We're not talking about this. We're talking about people like you and me who are just using devices to get a little bit about information so that we can start to take control. Because for too long, we have outsourced our health to health professionals, doctors, and some of us we don't know much about wellness or health. Some of us know about disease care, which is very important. Some of us know about which drugs to use for which symptom, which is very important. But health and wellness is what the majority of people, I think anyway, are hoping to optimize now, because there is one thing about living forever, but it's what's your health like when you're living extended living, right? If you're going to be spending the extra 20 years that you've bought yourself living in a nursing home, unable to clean yourself, that's a different story, you know. So I like to buy toys because I like the information, and then also because the average person who's interested in optimizing health is very well researched and listening to all the podcasts and like yours, for example. And I want to be able to discuss these things with my patients. I love the fact that people are taking control of their health. And I want them to come to me and be able to discuss this with me. Being a they need to be at the helm of that health boat.
Yeah.
So it was also to know what the kids are saying.
Yeah. I mean, it's interesting, isn't it? Because if you are that person who would rather outsource your health, if the only thing you know about health is your doctor's phone number, then there is a whole industry waiting out there to embrace you with open arms.
Yeah.
I mean, it's one of the reasons why the pharmaceutical industry generates $1.2 trillion a year. That's $1.2 trillion a year. So there's a lot of people out there that only know their doctor's phone number. Yeah. But this is interesting. But there's a downside to it as well, isn't there?
Yeah.
What's the downside, Liv? Tell me. I know what it is for me. I'll tell you my downside if you tell me yours.
Well, so I'm not religious about my toys. So that's the first thing.
That's good. That's important.
Yeah.
That's important.
Because when you're obsessing about the numbers, sometimes you forget to look at the clinical picture. And it's the same with health practitioners looking at blood results, right? When you're just looking at the blood results and not at the patient in front of you, you can actually lose sight of what it is that you're trying to do. I have definitely had patients who will obsess about the data, get themselves anxious about it. They think they've had good sleep, and then the data coming back says that they didn't actually have as good sleep as they thought that they did, and it will actually ruin their day. Oh no, I didn't sleep that well last night, but
I thought I did.
Yeah, but you just said you didn't. But the data says, well,
Yeah.
So there's definitely that. The downside, I think, is that sometimes people can obsess about the numbers as opposed to how they feel, which is far more important to me. And if they're focusing too much on getting all this right, you start to forget as well the fundamentals, the foundations. How are you eating? How are you thinking? How are you breathing? How are you sleeping? Just really, really fundamental stuff, because we all have toys that we like to play with, and sometimes it shouldn't distract you from the basics.
I've kind of felt, and I can get obsessed by it. I have an obsessive character, but I can get obsessed by it. But actually, the way I've chosen to use this is for maybe 2 months every year.
Oh, okay.
That's what I'm going to do. I'm not going to have it on all the time. I'm in a 2-month phase now. I got this just before Christmas, and I thought, okay, I'm just going to go through the festive season and see how my eating or drinking affects me, and then move into a more quiet period, and then get into February and see how I'm going when I'm into the rhythm of the year. And that's it. February, I'm taking the ring off. I might re-engage with it next Christmas for a little bit of time, because I do think you can become too obsessed by it, but I think it gives you some great information.
Yeah, definitely.
Listen, we're coming to the end, and I just wanted to ask you this. Taking a step back from your role as a functional medical practitioner, because we're all on this journey through life in this modern world, what do you think the biggest challenge is for us on this journey in our modern world?
Well, do you also want the meaning of life? Because it's 42. Hey. No.
It's 42. I knew that. I read that a long time ago.
So the biggest challenge that we're facing as practitioners?
As people. No, as you, as an individual.
Oh, wow.
Forget you're a practitioner. Pretend you're an ordinary person.
Geez, okay. The biggest challenge for me, I think, is the loss of connectivity. whatever that means for you, you know. We just looking at the kind of TV shows that are coming out, it's all designed to have you addicted to staring at a screen. The fact that we're all on our phones, including me. I lose sleep because I'm watching cat videos, right? Just ridiculous things like that. But when I had my family up to Queensland, yes, we did get sick. But apart from that, that community, my relatives, my family, my dad, my brother and sister don't live in the same country, don't live in the same state as me. Having that community actually showed me how different life can be when you disengage from electronics, from mass media, from the narrative that's being pushed on you, whatever that may mean. And, I talk to my patients. So many of my patients come through with issues that in part is because of this loss of connectivity. New moms who are struggling, thyroid depletion, postnatal depletion type stuff. That's because we no longer live in a village. There isn't that, if you're too tired to breastfeed, the lady next in the next hut will breastfeed for you. We don't have anything like that. Our kids are getting sicker and sicker as we move through because there's no connectivity with nature, with farm animals, which has actually been shown in papers that it decreases the incidence of allergies, asthma, and obesity if your mom, when she was pregnant with you, was interacting with farm animals, for example, or on a farm, or dogs, cats. This loss of connectivity, I think, is really dangerous because we don't realize that that's happening because we are even more connected, right? The number of followers that we have on Instagram or Facebook, whatever. I was actually going through my Facebook the other day, and I realized as I was scrolling through, I didn't know some of the people who I apparently am friends with. How bad is that? So I would say that is a big, big problem for us.
Olivia, what a note to finish on, and thank you so much for sharing so much great information and knowledge. And what a great note to finish on. Get connected. Thank you.
Oh, you're welcome, Ron. Thank you so much for having me.
What a great note to finish on. Connection. I mean, if that's one lesson we have learnt through this pandemic, it is a timely reminder that while we may have lots of friends on Facebook or followers on Twitter or Instagram, there's something quite special about the human connection, which is the theme we're going to be exploring a lot more this year in terms of understanding, really, why that is such a powerful driver and has been such a powerful driver in our journey through evolution, if you like. And so we've been all reminded of how important that is. And honestly, I thought, boy, if you had to pick the greatest challenge for our health moving forward as an individual, connecting is one of them. And our distraction, you will know from the summer series that we've also had Jocelyn Brewer talk about digital nutrition, and Nia Eyal talking about being indistractable, which we all are very distractible. And that is our big challenge. I mean, we walk around constantly being distracted. We need time for letting our minds wander. We need quiet time. We need to reconnect with people. And I'm certainly looking forward to the year ahead as being one of much greater connection. So I hope you enjoyed this week's episode. Until next time, this is Dr. Ron Ehrlich. Oh, and we will have links, of course, to Olivia's website. Her LifeSpan medicine platform is really a great resource, and Olivia is a great practitioner, and it was a pleasure having her on today. So we'll have links to her site on the show notes. So I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health and related subjects. Content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.